So imagine you're walking through a city park early in the morning.
Right, sun's just coming up.
Yeah, exactly. The dew is still heavy on the grass, and the distant sound of traffic is just starting to build.
And you see that group.
Yes. You see a group of people, usually older adults, standing together in this loose circle under the trees.
Just moving in what looks like, well, impossible slow motion.
Right, their arms are drifting through the air, and they're shifting their weight from side to side in complete silence.
It looks like this synchronized, totally effortless dance.
Effortless is the perfect word.
Yeah, it really looks as though they're moving gracefully underwater, like they're suspended in some medium that takes away all gravity and joint impact.
And if you're like most people, you probably walk past, look at that group, and think something like, oh, that's nice.
Good for them.
Right, a little light stretching, a little fresh air. I mean, it looks soft. It looks mystical almost.
Completely disconnected from what we think of as modern, rigorous fitness.
Exactly. For a lot of us who are used to like high-intensity interval training or heavy weightlifting, it just doesn't compute as a workout.
It seems like a pleasant way to pass a Tuesday morning, maybe, but certainly not something you'd mistake for a high-level clinical medical intervention.
But what if I told you that underneath those flowing movements, underneath the silk uniforms and the quiet park setting, is a highly sophisticated biomechanical engine?
And it's an engine that modern medical science is currently absolutely obsessed with.
We are talking top-tier rheumatologists, geriatricians, neurologists.
Yeah.
So welcome to this deep dive. Today, we are taking a massive microscope to Tai Chi or Taijiquan.
And we're doing it with a very specific, no-nonsense lens.
Right, because that lens is the most important part of this entire conversation.
Absolutely, because you, listening to this right now, probably want the absolute bottom line.
You want to understand complex health topics without having to wade through, impenetrable medical jargon.
But you also don't want the mystical fluff.
Right, no wellness buzzwords.
You want to know the mechanisms. You want to know what actually works inside the human body.
So our source material today is this phenomenal, incredibly comprehensive, evidence-based German guide. It was designed specifically to evaluate Tai Chi for beginners.
And the origin of this document is what makes it so good.
Germany has incredibly strict health insurance regulations.
Oh, incredibly strict. Their central testing agencies demand rigorous, hard proof before they will subsidize any preventative health program.
So this guide just strips away all the folklore.
Totally ignores the movie tropes.
Yeah. Instead, it looks purely at rigorous clinical data, these massive medical meta-analyses, and practical real-world application.
It approaches Tai Chi the exact same way a medical review board would evaluate a new pharmaceutical drug.
Or like a post-operative physical therapy protocol.
Exactly. It demands answers to hard questions like, what is the required dose?
What are the clinical
What
endpoints?
are the adverse effects? We're not talking about chakras here.
Right. No energy fields. We're talking about joint angles, load-bearing mechanics, and nervous system regulation.
Because our mission for this deep dive is to find out what Tai Chi actually does to your physiology based entirely on peer-reviewed science.
And more importantly, how you can extract those proven benefits without having to, pack up your life, buy a silk suit, and move to a martial arts monastery in the mountains.
Which is a huge relief, right? Because the clinical benefits are profound, but the way you access them in your daily life is highly pragmatic. You really don't need a lifestyle overhaul to see the results.
Okay, let's unpack this. Because before we can even begin to dive into the medical benefits, and we're talking staggering effects on the heart, the joints, the brain, we have to clear away a massive amount of cultural baggage.
Yeah, Tai Chi suffers from a bizarre dual identity crisis in the West.
It really does. On one hand, pop culture views it as this mystical, ancient secret requiring deep spiritual devotion.
And on the other hand, the fitness industry just dismisses it as a gentle wellness activity for seniors in nursing homes.
And both of those extremes completely obscure the reality.
So to find that reality, we really have to start by dismantling the origin myth, because this is where a vast majority of that mystical aura comes from.
Right. If you pick up a brochure for a local class or browse traditional martial arts websites, you're almost definitely going to encounter the story of Zhang Sanfeng.
The Taoist immortal.
It is a fantastic story, honestly. According to the legend, Zhang Sanfeng was a monk who was observing the natural world one day, and he witnessed this fight to the death between a snake and a crane.
Or a magpie, depending on who's telling it.
Right. And he watched the soft, yielding, circular movements of the snake effortlessly evade and overcome the rigid, aggressive linear attacks of the bird.
And in that exact moment of divine inspiration, he invented Tai Chi.
I mean, it sounds like the opening scene of a massive blockbuster movie.
It's beautifully poetic, but modern historical research, specifically from martial arts historians who rely on primary documents rather than oral folklore, they view the Zhang Sanfeng story as a constructed
It
tradition.
was a myth.
It's a myth. Researchers point out that this narrative was formulated much later in history.
It was woven together with political motives, right?
Yes, political and identity-forming motives. It was essentially designed to give the practice this veneer of ancient, divine, and distinctly philosophical authority.
But I look at that and think, ah, does the origin story even matter to the person listening right now?
Not at all.
Like, if I go to a dealership to buy a new car, I care about the crash test ratings, the fuel efficiency, how it handles.
Right.
I don't care about the biography of the 19th century engineer who invented the internal combustion engine.
Exactly.
So for someone dealing with knee pain or insomnia, why should they care if Tai Chi was invented by a magical monk or a regular soldier?
Well, they shouldn't. And the evidence-based guide makes that point explicitly. The historical reality is that the actual documented roots of what we now practice as Tai Chi tie back to early modern texts around the year 1669.
In a specific village in China, right?
Yes, and it originated in brutal military and martial contexts.
So it was a literal battlefield combat system for militia defense.
Exactly. Long before it was heavily adapted and softened over centuries into the health-oriented practice we see today.
Okay, but the guide concludes that this history, while academically interesting, is medically irrelevant.
Completely irrelevant. The clinical evidence we're going to explore relies entirely on the physics of the movement.
Dosing, biomechanics, adherence.
Yes, it does not rely on the biography of the founder.
Which frees us from having to adopt a belief system to get the benefits. And that leads directly into the second massive hurdle we need to clear.
The mystical energy myth.
Right. I've had friends tell me, oh, I can't do Tai Chi. I'm just not a spiritual person.
I don't believe in Qi.
Yeah, I don't believe in Qi or Yin and Yang, so it won't work for me. There's this pervasive idea that the physical movements are just a vehicle for manipulating invisible energy fields.
But when researchers at institutions like Harvard Medical School or the Mayo Clinic study Tai Chi, they aren't trying to measure invisible energy.
Right. They treat it purely as a complex mind-body and neuromuscular intervention.
They use force plates to measure balance. They use EKGs for heart rate variability. They look at blood serum levels for stress hormones.
They're looking at the biology of the human animal.
Exactly. So someone can treat it entirely like an exercise class.
They can focus purely on the mechanics of their joints and muscles without a single shred of spiritual belief.
And still get the exact same blood pressure drop as the person next to them who firmly believes they're cultivating cosmic energy.
I mean, the physiological adaptations happen regardless of your personal philosophy.
The biomechanics do the work. If you execute a slow single-leg weight transfer with perfect alignment, your nervous system is going to adapt.
Your stabilizing muscles are going to strengthen.
And your balance will improve. The body responds to the physical demand, not the spiritual intention.
That is incredibly liberating for a lot of people. But we also have to guard against the opposite extreme.
Right, the panacea myth.
Yeah, if one side says it's magic, the other side, often the people selling DVDs or expensive retreats, says it's a magic bullet.
A bullet that will single-handedly cure everything from rheumatoid arthritis to terminal illnesses to chronic hypertension.
And this is where scientific rigor must be fiercely applied. The medical literature does not use the word cure when it comes to Tai Chi,
No, it doesn't. Take osteoarthritis, for example.
which is the physical wearing away of the cartilage in your joint.
Yes, and no amount of slow movement is going to regenerate that lost tissue and give you the pristine knee of a teenager.
It's a movement practice, not a time machine.
Right, we can't reverse the structural aging of bone.
What the data shows, however, is that it provides massive symptom and functional management.
It is a world-class preventative and rehabilitative adjunct. It can drastically alter how your body supports that damaged knee.
So it can strengthen the vastus medialis muscle to track your kneecap better.
It can downregulate the pain signals in your brain.
And it can significantly improve your functional mobility.
It manages conditions brilliantly. And to someone who's been suffering, that management can feel like a cure, but we have to maintain that clinical distinction.
Okay, so we have our foundation. Tai Chi is a physical biomechanical exercise that requires no spiritual belief, but offers powerful, measurable symptom management.
Right.
But anyone who has watched that group in the park is immediately struck by a paradox.
How can something so slow trigger real physiological changes?
Exactly. How can something that gentle, that seemingly lacking in resistance or cardiovascular strain, do anything? In fitness culture, we're taught that if we aren't sweating, panting, and pushing to muscular failure, nothing is happening.
But the slowness is the feature, not the bug. The assumption that moving slowly equates to a lack of physical effort is honestly a fundamental misunderstanding of human biomechanics.
I really want to use an analogy here because this was a huge aha moment for me when looking at the sources.
Go for it.
Think about driving a manual transmission car.
Okay.
If you're on the highway going 65 miles per hour in fifth gear, driving is almost completely effortless.
Right, your foot is entirely off the clutch, you're just cruising.
The momentum of the vehicle is doing 90% of the work. But try driving that exact same manual car at 1 mile per hour in a parking lot.
Oh, it's incredibly taxing. You're constantly micro-adjusting.
You're riding the clutch, hovering over the brake, trying to feed just enough gas to keep the engine from stalling, but not enough to jerk forward.
It requires 10 times the focus and 10 times the mechanical control to maintain a speed of 1 mile per hour than it does to coast at 65.
And that is exactly what Tai Chi does to your skeletal structure. Because in normal walking, we basically just throw our center of gravity forward and catch ourselves with our next footfall.
We're using gravity and momentum to travel. It's basically a controlled fall.
Right.
You've just described the stretch-shortening cycle and our reliance on passive momentum. When we walk normally, we spend a fraction of a second in a transitional phase.
But the expert guide breaks down the mechanics of the Tai Chi step, and it's a completely different physical task.
You are deliberately slowing that controlled fall down to an absolute crawl.
You aren't falling at all. You're placing your foot.
Exactly. You start with a 50-50 weight distribution, standing equally on both feet. Then you begin a continuous momentum-free shift to a 70-30 distribution.
Or even 1,000 distribution.
Yes. You are enduring extended single-leg stance phases.
Okay. Walk me through what that actually feels like in the body.
Imagine standing with your right leg slightly bent. You must balance your entire body weight on that one bent leg while your left leg slowly reaches out, lightly touches the heel to the floor without putting any weight on it at all.
Okay.
And only then do you slowly, millimeter by millimeter, transfer the weight over.
Which means your muscles are denied the luxury of momentum.
Completely. Your quadriceps, your gluteus medius, your ankle microstabilizers, they are firing continuously under load.
It's essentially a dynamic moving wall sit.
Yes, and doing that for 20 or 30 minutes is an intense muscular endurance event.
And you're layering complexities on top of that base, too.
Right, because while the lower body is executing these grueling slow-motion weight transfers, you're integrating trunk rotations.
Your upper body is twisting and rotating over this highly stabilized foundation.
Which forces the core muscles, like the obliques, the transverse abdominis, to engage constantly just to maintain posture.
And as if the physical demand wasn't enough, there's the cognitive load. The guide really emphasizes the dual-tasking nature of the practice.
Dual tasking is a critical concept in neurorehabilitation. It means you're performing a complex physical task and a complex cognitive task simultaneously.
So your brain is trying to process the proprioceptive feedback from balancing on one bent leg.
While simultaneously remembering the sequence of the choreography, monitoring your spatial alignment, and tracking your breathing.
That combination of cognitive load and physical load places an incredible demand on the central nervous system.
It is a simultaneous workout for the brain and the body.
But that cognitive load brings us to a massive barrier for beginners.
Oh.
I mean, a lot of people try Tai Chi, go to a class, and quit after 3 weeks.
Because they're told they have to learn a sequence of 108 distinct movements.
Yes. It's incredibly intimidating.
Yeah.
People feel like they're trying to memorize a 3-hour ballet, and they think they won't get any health benefits until they master the whole thing 5 years from now.
That intimidation factor is very real, but thankfully the clinical evidence completely dismantles the need for those massive traditional routines.
So you don't need the 108 movements.
Not at all. Historically, yes, the long forms can consist of 88 or 108 postures and take 20 to 30 minutes to perform a single repetition.
Right.
But the researchers conducting these rigorous medical studies recognize that a 108 movement form is an impossible barrier to entry for a 70-year-old looking for health benefits.
So what did the researchers do instead?
They isolated the active ingredients. They developed and tested simplified short forms like the incredibly popular 8-form core routine.
Wait, literally just 8 movements.
Just 8 movements repeated symmetrically. And the research overwhelmingly proves that these short, simplified routines achieve the maximum clinical effects.
That's amazing. So the therapeutic value isn't found in the memorization of a lengthy choreography.
No, the value is entirely contained within the quality of the biomechanical movement.
The slow weight shifting, the alignment, the single leg stance.
You get all of that in 8 movements just as effectively as you do in 100. The long forms are wonderful if you enjoy the art, but strictly from a medical perspective, they are entirely optional.
That is the ultimate relief.
Yeah.
The minimum effective dose is actually highly accessible.
Yes.
Because Tai Chi fundamentally rewires how you stabilize your center of gravity. The most immediate life-saving application of this practice isn't in a martial arts tournament.
It's in preventing catastrophic falls.
And this is where the medical data transitions from interesting wellness trend to critical public health intervention.
Because falls among older adults represent a staggering global healthcare crisis.
We really need to paint a picture of just how devastating a fall can be. When we're young, we trip, we scrape a knee, we get back up.
But for an older adult, a fall is often a life-altering trauma. It leads to hip fractures, traumatic brain injuries, long hospitalizations.
But even worse is the psychological aftermath, right? Even if they recover physically, the fear of falling again becomes paralyzing.
They stop walking to the store, they stop gardening. Their world shrinks to the size of their living room because they are terrified of their own balance.
The loss of independence is profound. Which brings us to the Cochrane Review on Tai Chi and fall prevention.
And a Cochrane Review is widely considered the platinum standard of evidence-based medicine.
Explain what that is for the listener.
It's a systematic review that gathers all the high-quality, randomized controlled trials on a specific topic, weeds out the poorly conducted studies, and pools the data to find the absolute statistical truth.
And when the Cochrane Review aimed its sights on Tai Chi, the numbers were definitive.
Very definitive. They found a 20% reduction in fall rates among older adults who practice Tai Chi.
Which equates to a rate ratio of approximately 0.80. But to put that 20% reduction into a real-world context?
Yeah, if you take a population of seniors who are statistically projected to experience 1,000 falls this year, implementing a Tai Chi program wipes 200 of those falls off the map entirely.
And the cascading effect of preventing 200 hospital admissions, surgeries, and losses of independence is massive.
Huge.
But how do they actually measure this improvement before a fall happens, like in a clinical setting?
The studies rely heavily on something called the Timed Up and Go test, or the TEGO test.
It's a brilliant, simple clinical diagnostic.
It really is. The doctor asks the patient to sit in a standard chair. On the word go, the patient must stand up without using their hands if possible, walk 3 meters across the room, turn around, walk back, and sit down.
It seems like a mundane sequence, but it requires core strength to rise, balance to initiate gait, and crucial proprioceptive control to manage the 180-degree turn.
And that turn is where many falls actually occur.
Right, and the meta-analyses demonstrate that Tai Chi practitioners improve their TUG scores significantly, completing the test roughly 0.69 seconds faster on average.
Nearly 3/4 of a second faster.
That isn't just about walking speed, though, is it?
No, that is a direct reflection of neurological confidence. Their muscles are firing faster, their hesitation is gone, their brain is trusting their legs again.
They also test functional reach, where the patient stands flat-footed next to a wall and reaches forward as far as possible without taking a step or losing their balance.
Which tests the limits of their stability. Tai Chi practitioners increase their reach by an average of 2.69 centimeters.
So their base of support becomes measurably larger and more stable.
Yes.
Those are fantastic baseline numbers. But the source material highlights one specific program that takes these statistics to an almost unbelievable level.
Oh, the TJQMBB program, Taijiquan, moving for better balance.
Let's talk about that, because it's an evidence-based derivative.
Right. This program was developed by researchers who essentially distilled traditional Tai Chi down into a pure, targeted fall prevention protocol.
They removed the complex martial arts transitions and hyper-focused on the specific movements that train postural control and recovery strategies.
And the results of their trials are staggering. They compared this specific program directly against a regimen of standard conventional stretching exercises.
They looked at the incidence rate ratio, or IRR. For the Tai Chi group, the overall IRR was roughly 0.42.
And an IRR of 0.42 translates to a 58% reduction in falls compared to the stretching group.
I mean, more than half the falls vanished.
Exactly.
But the statistic that truly blew my mind was when they isolated serious injurious falls.
The kind that break bones and require emergency room visits.
Yes. For those severe falls, the IRR was approximately 0.25.
A 75% reduction in catastrophic falls compared to standard stretching.
I have to pause here because that number demands an explanation. Why?
Well,
Like, why does moving your arms slowly in a church basement or a city park prevent you from breaking your hip in your kitchen 6 months later? Why is it so vastly superior to walking on a treadmill or stretching your hamstrings?
the answer lies entirely in the biomechanics we discussed earlier. Think about the anatomy of a trip.
Okay.
You're walking through your kitchen, and the toe of your shoe catches the edge of a rug. Your forward momentum instantly turns into a downward plunge.
Right.
To save yourself from hitting the tile, your central nervous system has to instantly recognize the sudden shift in your center of gravity.
It has to fire a lightning-fast signal down your spinal cord to your leg.
Your leg must rapidly step out, plant firmly on the ground, absorb the entire kinetic energy of your falling body weight, and stabilize you on that single, suddenly loaded joint.
And all of this must happen in a fraction of a second. It's an extreme neuromuscular reflex.
Exactly. And standard stretching does absolutely nothing to train that reflex.
Walking on a treadmill doesn't train it because the belt is moving for you and you're holding the handrails.
But Tai Chi is the literal, deliberate rehearsal of that exact recovery reflex.
Because what are you doing in the form? You're constantly shifting your center of gravity to the edge of your base of support.
You're deliberately stepping out, planting the heel, and systematically transferring your entire body weight onto one bent, stabilizing leg.
You are grooving the exact neural circuits required to catch your body weight.
Mm.
You are meticulously practicing the act of not falling down.
You're installing a software update for your nervous system's balance protocol.
I love that. Running the simulation thousands of times slowly so that when the sudden rug trip happens in real time, the hardware knows exactly what to do.
And the microstabilizers in the ankle and knee have been strengthened under slow, continuous load, meaning they actually have the physical capacity to halt the fall when called upon.
But to successfully execute that life-saving step, to absorb that sudden kinetic energy, you need joints that can handle the load.
Right.
And this naturally brings us to how this practice interacts with the physical structure of the body, specifically joint conditions and chronic pain.
The two areas that plague almost everyone as they age are the knees and the lower back.
Knee osteoarthritis is a major focus in the literature. As we established, this is the painful degradation of the cartilage that cushions the knee joint.
The resulting inflammation causes severe pain, stiffness, and a drastic reduction in the ability to perform daily tasks like, climbing stairs.
Our sources detail a landmark 52-week pragmatic randomized controlled trial, an RCT, that set up a head-to-head comparison.
They took patients with symptomatic knee osteoarthritis and split them into two groups.
Right, one group did Tai Chi twice a week for 12 weeks. The other group was sent to standard clinical physical therapy.
Administered by licensed therapists twice a week for 6 weeks, supplemented by rigorous home exercises. And they tracked these patients for a full year.
To measure the outcomes objectively, they used the WMAX score.
The Western Ontario and McMaster University's Osteoarthritis Index.
That's a mouthful.
It is, but it's the absolute gold standard medical questionnaire used by orthopedic surgeons and rheumatologists to assess the severity of joint pain, joint stiffness, and physical disability.
And the results of this head-to-head matchup are completely counterintuitive to anyone who believes you need a sterile medical environment to heal.
Both groups experienced significant improvements in their WOMAC scores, but the critical headline-making finding was that there was no significant difference in joint improvement between the Tai Chi group and the physical therapy group.
Let's let that sink in. Attending a community class and moving through a gentle martial arts-based sequence was just as effective at rehabilitating an arthritic knee as attending a clinical, medically supervised physical therapy regimen.
I mean, in broader meta-analyses, when compared to non-exercise control groups, Tai Chi demonstrates a moderate to strong effect on pain, with a Cohen's d of approximately negative 0.64.
But the trial revealed something even more fascinating.
The psychological aspect.
Yes, while the physical improvements in the joint were tied, the Tai Chi group pulled ahead in psychological metrics.
They showed stronger, statistically significant improvements in depression scores and their overall physical quality of life.
which makes perfect psychological sense if you think about the environment.
How so?
Well, if you go to a clinical PT office, you're defined by your injury. You sit on a vinyl table under fluorescent lights, counting out sterile leg lifts. You are a patient receiving treatment.
Right.
But if you go to a Tai Chi class, perhaps outdoors or in a community center with music, you're learning a complex skill alongside other people. You're defined by your capacity to learn and move.
You transition from a passive patient to an active practitioner. And that shift in identity, combined with the social support of a class, dramatically elevates mood and adherence.
We see incredible data for the knees, but the guide also tackles chronic lower back pain.
Which is a huge one.
Anyone who has dealt with lower back issues knows it is a frustrating, agonizing puzzle. The guide points to a recent meta-analysis compiling 14 different RCTs involving nearly 1,000 people.
And the numbers show a massive pain reduction for chronic lower back pain, with a standardized mean difference, an SMD of roughly negative 2.14.
That is an enormous statistical effect size. It suggests profound relief for back pain sufferers. However, the data carries a massive flashing warning light.
Yes, the researchers explicitly flagged this result with the phrase very high heterogeneity.
When I read that, I had to ask, what does that actually mean for the listener right now who has a bad lumbar spine and is reaching for their phone to find a local class?
High heterogeneity means the results were incredibly inconsistent across the different studies.
Okay.
So while the overall average showed massive pain reduction, some studies showed incredible results, while others showed minimal or even negative results. The variance is extreme.
Why is the data so messy?
Because Tai Chi is an intervention delivered by a human being, not a pill stamped out in a factory. The results depend heavily on the instructor's biomechanical knowledge, the specific style taught, and how meticulously the participants adhere to proper alignment.
Which brings us to the most crucial safety warning of this entire deep dive. Doing this wrong is not just ineffective, it can be actively harmful.
Yes. Remember the fundamental posture we discussed, the continuous semi-bent knee. You are lowering your center of gravity by maintaining a slight squat throughout the practice.
Right.
If you have chronic joint pain, whether in the knee or the lower back, and you execute this bent knee position with poor structural alignment, you will provoke and exacerbate your pain.
We're talking about sheer force on a vulnerable joint.
Yeah.
If your knee collapses inward, what trainers call valgus collapse, or if your knee pushes too far forward past your toes, all of your body weight is violently torquing the ligaments and the compromised cartilage.
Proper form is absolutely non-negotiable. The vertical alignment of the head, shoulder, and pelvis must be maintained to protect the lumbar spine.
And the knee must track perfectly over the center of the foot.
Exactly. If you're learning from a YouTube video in your living room, you can't see your own structural flaws. If an instructor in a class isn't constantly adjusting your knee alignment, you're just grinding bad mechanics into an already injured joint.
So, assuming you find a competent instructor and you dial in that perfect, safe structural alignment, the mechanical benefits for balance, knee arthritis, and back pain are undeniable.
Undeniable.
But what blows my mind is how these external physical movements trigger profound internal systemic changes. How does moving your arms and bending your knees alter your brain chemistry, your cardiovascular system, and your immune response?
This systemic impact is the current frontier of the research, and the findings are remarkable. We really have to start with sleep, specifically chronic insomnia.
Anyone who has suffered from true insomnia knows it is a form of torture. It decays your cognitive function, ruins your mood, and destroys your metabolic health. You just lie awake staring at the ceiling, your mind racing, trapped in a state of hyperarousal.
And standard medical treatments often lean heavily on pharmaceutical sedatives, which carry a significant burden of side effects, dependency risks, and grogginess, particularly for older adults.
The sources detail several RCTs focusing on older adults suffering from insomnia who were placed in Tai Chi programs.
The objective sleep metrics improved across the board. Overall sleep efficiency increased by 3.4%.
Sleep efficiency meaning the actual percentage of time you spend asleep while in bed, rather than just lying there tossing and turning.
Exactly. Even more importantly, it decreased a metric called wake after sleep onset by 13.3 minutes.
Wake after sleep onset is that miserable phenomenon where you fall asleep fine, but you wake up at 3 a.m. and cannot get back to sleep.
Right. Reclaiming 13 minutes of depth sleep in the middle of the night is a huge victory for cellular repair.
But there is a specific study in the guide that is truly mind-bending, the non-inferiority trial for chronic insomnia. Walk us through how they set this up.
The The researchers wanted to test Tai Chi against the absolute best treatment modern psychology has to offer. They compared it head-to-head with CBTI, cognitive behavioral therapy for insomnia.
For context, CBTI is a rigorous, intensive psychological protocol.
Very rigorous.
It involves sleep restriction therapy, cognitive restructuring to eliminate sleep anxiety, and strict sleep hygiene rules. It is grueling work, but it's highly, highly effective.
It's the gold standard. In this trial, they took patients over 50 with chronic insomnia. At the 3-month mark, the CBTI group had clearly better results than the Tai Chi group. The targeted psychological intervention worked faster.
Okay, that makes sense.
But the researchers didn't stop there. They followed these patients for 15 months. And at the 15-month mark, the Tai Chi group had completely caught up. The data showed that over the long term, Tai Chi was not inferior to intensive cognitive behavioral therapy.
That is staggering. Learning to shift your weight and move slowly in a park was eventually just as effective at curing a neurological sleep disorder as undergoing months of intensive psychiatric behavioral therapy. How is that biologically possible?
It comes back to the concept of dual tasking and the regulation of the autonomic nervous system. Insomnia is driven by cognitive rumination. The brain is trapped in the sympathetic fight-or-flight state, pumping out cortisol and adrenaline. When you practice Tai Chi, you engage in what researchers call task focus.
So you're forcing your brain to process so much physical data, the weight in your foot, the angle of your wrist, your breathing rate, that there is simply no processing power left over to ruminate on your stressful job or your financial worries.
Precisely. You are mechanically training your nervous system to downregulate. The slow, rhythmic breathing and the intense physical focus stimulate the vagus nerve,
Which forcefully shifts the body out of the sympathetic stress state and into the parasympathetic rest and digest state.
You're practicing the physical state of calm, which lowers your baseline physiological arousal over time, allowing sleep to naturally occur at night.
Which explains why the data on mental health, stress, anxiety, and depression is also so promising. The sources show a moderate effect on perceived stress with an SMD of about -0.41.
Yes, though the guide is admirably transparent. When researchers look at larger, more rigorously controlled studies, that effect size does shrink somewhat.
Right.
It shows consistently favorable signals for reducing anxiety and depression, particularly in older adults, but we must be responsible with the conclusions.
Right. The guide makes it explicitly clear that Tai Chi is not a replacement for psychiatric medication or professional psychotherapy if you're suffering from a severe clinical disorder like major depressive disorder.
It's an intervention, not a miracle cure for clinical pathology. However, it is a highly effective, low-barrier adjunct therapy.
You practice it alongside your prescribed medical treatments.
And its power as an adjunct lies in adherence. It doesn't feel like taking medicine. It feels like learning an art form, which provides a sense of mastery and community that is inherently antidepressive.
And while the nervous system is calming down, the cardiovascular system is reaping massive benefits.
In a 12-month trial comparing Tai Chi directly to standard moderate aerobic exercise, the Tai Chi group actually reduced their systolic blood pressure by an additional 2.40 millimeters of mercury compared to the aerobic group.
Let's make sure we highlight that. It beats standard cardiovascular exercise for lowering blood pressure in that trial.
It really did.
That implies the blood pressure reduction isn't just about making the heart pump faster. It's about the profound vascular relaxation driven by that parasympathetic vagus nerve response we just talked about.
The blood vessels literally dilate because the stress hormones are gone.
It's a dual action benefit. Mechanical exertion combined with deep neurological relaxation. And this increased, relaxed blood flow inevitably benefits the brain.
The guide reviews the data on cognitive health, specifically mild cognitive impairment, or MCI, which is often a precursor to dementia.
The numbers look incredibly hopeful there, too. A meta-analysis showed a significant improvement on the Montreal Cognitive Assessment, the MoCA score, which is a standard test for memory and executive function. The improvement showed an SMD of plus 1.43. That's a huge statistical jump in cognitive function.
It is a massive jump. But we must note that the evidence is currently rated by the reviewers as low certainty because the study sizes were relatively small.
Sure.
However, the biological rationale is sound. The complex dual tasking, the spatial memory required to learn the sequence, and the increased cerebral blood flow all act as a powerful neuroprotective stimulus.
The signal is strong. We just need larger trials to confirm the magnitude. I want to touch on one more systemic surprise that feels incredibly relevant, especially over the last few years.
The immune system.
Yes, this is truly the ultimate mind-body connection in the literature. Researchers conducted an RCT on older adults, measuring cellular immunity.
They specifically looked at the varicella zoster virus, or VZV. This is the virus responsible for causing shingles.
And shingles is a horrendous, incredibly painful nerve condition that flares up when the immune system weakens with age or stress.
The study found that regular practice actually enhanced the VZV-specific cellular immunity. The T cells responsible for fighting the virus were measurably more active.
Even more astonishing, when they administered the standard shingles vaccine to the participants, the Tai Chi group mounted a significantly stronger, more robust immune response to the vaccine compared to the control group.
So the physical practice of shifting weight and breathing slowly lowered their stress hormones enough to unleash their immune system, making a medical vaccine work better.
That is just unbelievable. So let's take a breath.
Okay.
We have a practice that rewires neuromuscular reflexes to prevent catastrophic falls, matches the efficacy of clinical physical therapy for arthritic knees, rivals intensive cognitive behavioral therapy for managing chronic insomnia, lowers blood pressure better than some aerobic exercise, and potentially primes your immune system to fight off viruses.
It's quite the list.
If you're listening to this right now, you're almost certainly thinking, okay, I am sold. The data is undeniable. But how do I actually start doing this without getting overwhelmed?
Right.
This brings us to the pragmatic beginner's guide. How does a modern, busy person practically implement this evidence into their weekly routine?
The very first hurdle is understanding that Tai Chi is not a monolith. It's an umbrella term encompassing several distinct historical styles.
Choosing the right style for your specific body and your specific goals is critical, especially if you have existing joint pain or physical limitations.
The German guide provides a great breakdown of the four main styles. Let's start with the Yang style.
Okay, the Yang style.
Yang style is the most widely practiced in the world, and it is the style most frequently utilized in these clinical studies. Visually, it is characterized by large, sweeping, soft, and fluid movements.
It maintains a very slow, relatively even pace throughout the entire form, right?
Exactly. Because there are no sudden changes in tempo, it is highly compatible with beginners, older adults, and anyone using it for general health and relaxation.
Then there's the Chen style, which is the oldest historically documented style.
Chen style is a completely different beast. It is highly dynamic and visibly martial. It alternates unpredictably between slow, gathering, coiled movements, and explosive, rapid releases of power involving stomping the ground, fast punches, and deep athletic stances.
So if I'm an older adult with bad knees or I'm trying to recover from lower back pain, I should probably avoid the explosive stomping and deep squats of the Chen style.
Absolutely. Chen style is fantastic for healthy, athletic individuals looking for a rigorous martial workout, but it is absolutely not the starting point for joint rehabilitation or fall prevention.
Next, we have the Wu style. The guide describes Wu as a small frame style. What does that actually mean for the body?
A small frame means the physical stance is much narrower. The feet are closer together, the arm movements are more compact and stay closer to the torso, and the weight shifts are finer, more subtle, and internal.
Okay.
It requires intense internal focus and balance, but it involves much less deep knee bending, making it a good middle ground.
And finally, we have the Sun style.
Sun style is explicitly recommended by medical bodies for arthritis.
Oh, wow. Why is that?
It features a very high stance, meaning you are barely bending your knees at all compared to the other styles. Furthermore, it involves a unique stepping method where one foot constantly follows the other, so you are never stranded in a wide, vulnerable stance.
That makes sense.
It's incredibly agile and exceptionally gentle on the load-bearing joints, which is exactly why globally recognized programs like Tai Chi for arthritis are heavily derived from the Sun style.
Okay, so you identify a style, most likely Yang or Sun,
Mm-hmm.
if you're starting for health reasons. How do you physically begin? The guide outlines a fantastic, foolproof, two-step, real-world approach. It's a literal flowchart logic.
Step 1. You absolutely must start in a physical class in the same room as a qualified instructor.
I think of this like learning to swim. You would never watch a YouTube video about the freestyle stroke, walk to the deep end of a public pool, and just jump in. You would drown.
Right, you need an instructor standing next to you, physically adjusting your arms, telling you when to turn your head to breathe.
Because Tai Chi involves complex, loaded joint alignments, you need an instructor to act as your mirror.
As we emphasize when discussing lower back pain, incorrect structural alignment, specifically the vertical axis of the head, shoulder, and pelvis, and the critical tracking of the knee over the center of the foot can cause serious orthopedic harm.
An instructor is there to ensure you build a safe, structurally sound foundation. You stay in the class setting for several weeks to learn the safe mechanical parameters.
And once you have those safe parameters, step 2 is integrating independent home training.
Once you know how to move safely, you have to take ownership of the practice.
Yes. The clinical programs that generated these massive health benefits all expect and require participants to do homework outside of the class.
Which leads to the most common practical question. What is the evidence-based dose? How much time do I actually have to commit to get these results?
The guide provides a very clear, phased, weekly timeline. Let's break down the heuristic. For weeks 1 through 4, your only goal is building the habit and learning the neuromuscular basics.
So what's the dose?
2 times a week, you attend a class or follow a guided session. In addition to that, 2 times a week, you do a short 15 to 20-minute home practice.
And that home practice doesn't even need to be a full form, right? It can just be practicing the basic stance and weight shifting.
Exactly. So you are touching the practice about 4 days a week, but half of those days are extremely brief, manageable sessions.
What happens in weeks 5 through 8?
You're progressing the load. You aim for 2 to 3 longer sessions of 45 to 60 minutes per week. On your off days, you implement micro practices, just 10 to 15 minutes of mindful movement to keep the nervous system primed.
And then week 9 and beyond, you reach the maintenance phase.
By week 9, you lock into a targeted routine dictated by your specific health goals.
Let's break those goals down.
If your primary goal is strictly fall prevention and physical balance, the clinical data solidly points to a dose of 2 times a week for 60 minutes.
Okay, but what if your primary goal is neurological, meaning sleep improvement, insomnia management, or stress reduction?
Then the data strongly suggests increasing the frequency to 3 times a week to keep the parasympathetic nervous system consistently engaged.
But there is a massive caveat attached to this timeline, and we need to underline this because we live in a culture obsessed with instant gratification.
The speed of benefit.
Right? The guide discusses the speed of benefit.
Patience is quite literally a biological requirement for this intervention. If you're practicing to reduce your daily stress or to help wind down before bed, you might feel subjective, psychological improvements in a matter of days. You will step out of class feeling more relaxed.
But what about the hard, structural, physiological changes?
For objective clinical endpoints, physically rebuilding the neuromuscular balance pathways, structurally lowering your systemic resting blood pressure, or measurably reducing joint inflammation, the studies are uncompromising.
It takes a minimum of 8 to 16 weeks of consistent, continuous practice before those structural changes become measurable.
You cannot practice for 3 weeks, declare that your balance hasn't magically improved, and quit. The human body needs time to literally synthesize new tissue and rewire neural networks.
You're building new biological infrastructure. It takes time to lay the concrete.
Exactly.
Now, while you're putting in this time, what should your brain be doing? The guide is very specific about mindset and breathing.
We must remember that we have stripped away the mysticism. You aren't trying to achieve a transcendent spiritual trance or commune with the universe. The evidence suggests a highly practical, mechanical approach to the mind.
First, regarding breathing.
Use quiet, relaxed nasal breathing. You want to synchronize the breath with the physical movement. For example, the general rule is to exhale when you push forward, expand, or shift your weight downward. You inhale when you gather your limbs inward, rise up, or step back.
And the mental focus. Because a lot of people find meditation incredibly frustrating.
Do not try to empty your mind.
Yeah.
Trying to think about nothing is incredibly difficult and usually causes more stress. Instead, adopt what researchers call a task focus.
So fill your mind completely with the physical data of the present moment.
Focus entirely on the sensation of the weight transferring across the bottom of your foot. Focus intensely on keeping your knee perfectly aligned over your second toe.
By hyper-focusing on the complex physical mechanics of your body, you're inadvertently achieving a state of deep meditation. You're crowding out the anxieties about your inbox or your mortgage because 100% of your brain's processing power is dedicated to simply standing on one bent leg without falling over.
It is a functional, moving mindfulness.
And the studies show that this specific type of active mindfulness is highly effective for reducing perceived stress and lowering cortisol.
It's very effective.
We have covered an immense amount of ground and celebrated some incredible data, but to maintain scientific integrity, we have to look at the blind spots.
We really do.
We must explore the research gaps and the future of Tai Chi science. We have to acknowledge what the studies failed to tell us before we draw our final conclusions.
Science is an iterative, ongoing process, and the German guide is admirably honest about the current limitations in Tai Chi research.
The first major blind spot identified is the remarkably poor reporting of adverse events, or AEs.
This is a systemic problem across almost all non-pharmacological studies. When researchers test a new pharmaceutical pill, the regulations demand that every single headache, rash, or stomachache is meticulously recorded and published.
Right. But in movement and physical therapies, the researchers are often so culturally biased toward the benefits that they fail to properly document the negative physical side effects.
The guide classifies Tai Chi as low risk, but it explicitly warns that it is not zero risk.
Exactly. Now, serious adverse events like cardiovascular events, strokes, or major traumatic injuries during practice are statistically practically non-existent.
However, mild to moderate issues do occur, specifically musculoskeletal pain, sore knees, strained Achilles tendons, or tweaked lower backs.
These usually happen when beginners progress too quickly, overtrain, or practice with the poor form we discussed earlier.
We desperately need future studies to rigorously track these minor injuries so the medical community can create better, safer instructional protocols.
The second massive gap is the lack of standardization across the scientific literature.
When a meta-analysis attempts to pool the data from 20 different studies, they run into a major variable. Study A might use a traditional 24-form Yang style taught by a master with 40 years of experience.
And Study B might use a simplified 8-form routine taught by a hospital physical therapist who took a weekend certification course.
This varying instructor quality and vast stylistic difference makes it incredibly difficult for scientists to say definitively, this exact dose of this exact movement yields this exact result.
And the third gap relates directly to those amazing immunity findings we discussed earlier with the shingles virus.
Yes, the data on immunity is thrilling. The lab work shows a clear increase in cellular markers for immunity. The T cells are active. The biological signals look fantastic.
But in medical research, these are known as surrogate endpoints.
Although we know the microscopic cells are changing in a test tube, but we do not yet know if that biological change actually translates into a clinical reality.
Does having more active T cells actually stop you from catching the flu in the real world?
Does it reduce the rate of hospitalizations for pneumonia in the elderly? We simply do not have that hard long-term clinical outcome data yet.
So the science is incredibly promising, pointing to massive systemic benefits, but it is still evolving and finding its precision.
Absolutely.
Now, if you have listened to all this evidence and want to safely navigate this landscape, the guide provides excellent resources for finding a legitimate, evidence-based class rather than a mystical cash grab.
If you're located in the United States, your best bet is to look for programs that are officially endorsed by the CDC's Falls Compendium, specifically under the STEADY initiative, or programs endorsed by the Arthritis Foundation.
They specifically endorse evidence-based derivatives like the Taijiquan Moving for Better Balance program we discussed earlier.
And since our source material is German, we should highlight the specific quality indicators they rely on there because they represent a great model for what a regulated system looks like.
In Germany, you want to look for instructors carrying certifications from the DDQT, which is the national umbrella organization for Qigong and Taijiquan.
They enforce strict, multi-year training standards for their teachers. Additionally, look for the ZPP certification.
The ZPP is this central testing agency for prevention. If a course is certified by the ZPP, it means it meets such strict evidence-based criteria that German health insurance companies will actually subsidize the cost of your attendance.
It's treated with the same seriousness as finding a licensed physical therapist or a specialist.
Okay, we have covered a massive expanse of medical territory today. Let's summarize the sheer breadth of what we've unpacked. We are looking at an ancient martial combat system that has essentially been reverse engineered by modern medical science.
And the results of that rigorous reverse engineering are profound. We have clinical proof that it drastically prevents catastrophic falls by grooving neuromuscular recovery reflexes.
It matches the efficacy of standard physical therapy for painful knee osteoarthritis.
It rivals intensive cognitive behavioral therapy for the long-term management of chronic insomnia.
And it meaningfully lowers cardiovascular risk factors like high blood pressure.
All while requiring no expensive specialized equipment, no esoteric spiritual belief system, and no extreme joint-pounding physical exertion.
It is an entirely accessible intervention for almost any age group. Which leads me to a final provocative thought I want to leave you with.
Let's hear it.
Imagine waking up tomorrow to the news that a massive pharmaceutical company had just invented a revolutionary single pill. And the clinical trials for this pill show that taking it could reduce your risk of a serious, bone-breaking fall by up to 75%.
It could manage your debilitating knee arthritis pain just as effectively as going to clinical physical therapy.
It could lower your blood pressure, and it could match months of intensive behavioral therapy for curing your long-term insomnia.
If a single pill could do all of that simultaneously, it would be the most prescribed medication in the history of human medicine.
It would be a multi-trillion-dollar blockbuster drug.
Every single doctor on Earth would prescribe it to every patient over the age of 50.
But this drug already exists. The clinical effects are real and available right now. It just requires you to make a fundamental trade. You have to trade the modern passive convenience of simply swallowing a pill for the active, ancient discipline of movement.
In a world that is perfectly optimized for passive consumption, where our food, our entertainment, and our medicine are delivered to us instantly with zero effort, maybe the most radical, powerful health intervention you can possibly make is taking 15 minutes a day to simply stand up, shift your weight, and move deliberately.
Thank you for joining us on this deep dive. The next time you're walking past that city park and you see that group of people moving in an impossible slow motion, you will know they aren't just waving their arms in the breeze.
They're firing their microstabilizers, they are forcefully down-regulating their sympathetic nervous systems, and they're rewiring the neural circuitry of their brains.
Look at the world of movement through this new evidence-based lens. We'll catch you on the next one.